Hello, this is Kevin Hamlet. I'm the Director of Human Resources for Sound Family Medicine, and I wanted to share with each of you today that are watching this our new healthcare benefit plan that we're introducing in 2021. And so I'm going to go over some slides with you, and we're going to be setting up additional meetings to discuss these and answer questions that you have. So I'll go right ahead and start sharing those slides so you can see what we're talking about here. So the first thing I want to point out is the name of our new plan that we're designing for our new health plan, and that's the Sound Plan. And this was developed by a change agent committee of Sound Family Medicine employees across the company, and was voted on by our compensation executive committee, and came up with this new plan. So excited to have this new name designed by our own people. And I wanted to get into what we're doing here with this new plan. And what we'll go over in this short video is why we're upgrading our healthcare plan, why we're making this change, what we hope to accomplish, what are our goals with this, what is a community-owned health plan, some of the details behind that, and what are next steps. So why change? Well, we've had double-digit increases over the last decade to healthcare costs, both for the employer and employee across the United States, and especially with Sound Family Medicine. For our renewal for 2021, Aetna came to us with a almost 20% increase in costs because of our plan year expenses for this last year. That's not a sustainable way to approach a business, to do double-digit increases year over year. And so we're looking to find a new way to be able to improve those costs. So that takes us to our goal. So why create this community healthcare plan? And our goal is to provide all of our employees, along with our patients, with excellent, compassionate, and comprehensive care. We want to make plans that are affordable to our employees, and we want to engage the community with local providers, people that we trust and know, along with this plan, and provide greater transparency in the costs that we're doing. We believe together we can do this much better than a larger healthcare organization can do. So how are we going to do this? Well, by creating the community-owned health plan. This is being done across pockets of areas around the United States. Providers are coming together to ensure that patients are getting affordable, high-quality health care. And so that's what this approach is to do that on a consistent basis. And so what does that mean to you and I on this? Well, what that means is that this new plan, the Sound Plan, a community-owned health plan, will have lower fees and how you use the plan. So your cost for services, for healthcare, pharmacy, et cetera, will be lower without having to pay your deductible or co-insurance when you follow the guidance of a member advocate. We'll talk more about that later. You'll also continue to have high quality access to local physicians, providers, and facilities in the area. We're working to engage both CHI and multi-care in this regard to continue to provide those services. While many of the healthcare services are required to go to a pre-authorization process, we can in our plan pathways will be much quicker and easier to process for both you and your family. This doesn't negate your ability to go to the ER or an urgent care. You wouldn't have to call a member advocate in those situations. Involvement in building out this community-owned health plan and offering this, we reached out to all of you and asked for information regarding providers that you currently see so that we could reach out to them and engage them in participating in this plan. And we received over 125 different responses in our first wave of getting that information out. We're working with them to develop this. So this will happen over time. Nothing is immediate on this. There's 3 pathways to receive care in this new plan. Visiting a Sound Family Medicine provider, only have a $5 copay, regardless of which medical services are received from a Sound Family Medicine provider. Calling the member advocate and visiting a recommended provider or facility within the Sound plan pathway is going to range between $20 and $50, regardless, again, of the medical services received. So following that member advocate or seeing a Sound Family Medicine provider is going to give you the best savings in this new plan. Visiting any provider or facility of your choice is going to range from $30 to $40 an office visit. For some services, a deductible or coinsurance may apply depending on which plan you choose. So what do these plans look like? Well, this next slide shows that piece. This is very different from the three plans that we offer today through Aetna. The three plans today are considered high, two of the three plans today are considered high deductible health plans. And they are allowed under the IRS rules to use what we call an HSA or health savings account. And many of you that are involved in those plans have those. Effective April 1, based on the new plan that we're presenting here, those will not be eligible to continue to put money into. So your account will still be there. You'll still have access to the money that's already there. But effective April 1 of this year, you won't be able to put additional money into that. And the reason behind that is the way this plan is designed. Though the deductibles in the plans may seem higher, the reason that it doesn't qualify is because the access to care doesn't require the use of those deductibles if you're following the plan pathway or the network that's been built into it. In many cases, that if you're doing a preventive care visit, obviously that's always 100% free. But if you're seeing a Sound Family Medicine provider or you're another primary provider that's within the network, it could either be a $5 copay for a Sound Family Medicine provider or $40 copay for a non-SFM provider. Specialists and so forth have different copays to that. Labs, diagnostic testing, imaging would be free following the plan pathway, and outpatient mental health, chiropractic, acupuncture, outpatient would have copays associated to them, either $30 or $40 depending on the plan. Urgent care visits would be $50 or $75 depending on the plan, and ER visit would be $250 copay or $350. The hospital inpatient or outpatient or surgical procedures would be at $0. So vastly different than what we're having to experience today, where you have to meet the deductible to get the service before you can start receiving the benefits of the plan. Obviously, there's going to be lots of questions behind this, and you'll have a copy of this along with the email that's going out. Medical premiums effective April 1 will change as well. For many of you, you'll see the same or perhaps a reduced cost in what you see in your biweekly payroll premiums. For some of you that were in the more narrow network plan, the 5,000 plan, you may see an increase in that. We tried to work on how do we keep that to a minimum, and that's what ended up resulting us creating two different plans. And that's why you see the Sound plan for $6,000 and the Sound plan for $3,000. To try to bridge that gap between what's happening today versus what's going to move forward in the future. So I've mentioned several times this member advocate. What does that mean and what does that look like as we go forward? So calling a member advocate is, say you need to go to the doctor. You want to make an appointment. You're not sure if your doctor or healthcare provider is in the network. You'd call the member advocate. They're available Monday through Friday, 5 a.m. to 5 p.m. And you ask them, hey, is my provider in this plan pathway, or who would be the best one to see for this service? You then go to that provider that was recommended by the plan pathway, and this is typically done, no more than 5 to 7 days, sometimes a lot less than that. And so you'd go to that provider that was recommended. You have a great experience. You paid just the smaller copay. You wouldn't have that deductible or coinsurance that we talked about earlier. And then the plan then, as the administrator, the plan pays the provider based on the contracted rate that we've made with them as part of our community-owned health plan. And then you'll receive an explanation of benefits in the mail from the TPA or third-party administrator regarding this. So So that's the easy part of this. So what do you do if you need to go to the ER or urgent care? You go. Don't call the member advocate because you need to go now. And you follow along with the plan fees associated with that. Same as if you were traveling out of state. And then if it looks like it's going to be extended and it looks like it's outside of the network, contact the member advocate afterwards and let them know so that they can help and assist with that. So here's some example cost comparisons as we look at this and what's different in the current plans that we have versus what we're moving forward to April 1. So if we were to look at an average knee replacement, the total estimated cost for a knee replacement is about $57,000. In our current plan structure, your cost would be somewhere between $4,000 to $6,000 if you hadn't met any deductibles or out-of-pocket maximums. Under the new plan, your cost would be, if you went through a member advocate, assuming about 3 specialist visits and the copays associated to that of somewhere between $30 to $50, the highest end you'd pay is $150 or less. For stage 1 or 2 breast cancer, the total estimated cost of that is somewhere around $82,000. Under the current plan, that cost before deductibles and out-of-pocket maximums would apply, you'd be responsible for somewhere between $5,000 and $12,000. Under the new plan, that assuming a 25 visit thing, again, the same thing as the current plan, the cost for you would be somewhere between $750 and $1,250 or less, depending on the cost of that specialist. So significantly different, which means more money in your pocket to do other things that you'd like to do with your family. So you probably have a few questions, and there'll probably be a lot more than the questions that I've listed on here. But some of the questions that we've heard already from the change agents that we've been talking to throughout Sound Family Medicine have asked, will I still have my Aetna medical card? Well, no. Under this new medical plan, you'll receive a new medical ID with a new card from our new medical administrator. How will I get my prescriptions in this plan? Well, you'll be able to get prescriptions at 99% of any of the major local pharmacies across the United States. How can this plan cost less? Well, by directing our participants or members that join this plan, we're going to have pre-contracted rates with high quality providers to ensure that we have the lowest cost for the best care. That's how we do that and eliminate that middleman. Will my current doctor or healthcare provider be a part of the plan? Well, likely, but we're always going to receive recommendations for providers that you hadn't thought of before, and we're going to be contacting them. And if you want to recommend somebody, call the member advocate to confirm whether your provider's on there or whether you'd like to see if they could be added on there. And they'll reach out to see if we can make that happen. What if I have an emergency? Do I go to the ER or urgent care, or do I call the member advocate? If you have an emergency, go to the ER, go to the urgent care. Don't call the member advocate. You're planning ahead. If you're going to something that is going to require a referral for something, that's where you would want to call the member advocate to make sure you're getting the best service at the best cost. So how do I find out more? Well, I've mentioned several times all these change agents. Well, I'm listing here on the screen who those people are. These are amazing folks that are across our entire practice, across all the different departments. So please, if you know somebody in that list, come see them or come talk to us in HR and ask us questions. We're going to be setting up additional meetings to talk about this further in Q&A sessions on next week on Monday and Tuesday, February 8th and 9th from 11 to 12 or 12 to 1. And talk to your change agents and read the FAQ that I'm going to be posting with this. And then, of course, you can always contact any one of us in HR. You can contact Donna, myself, and or Megan, our benefit broker. So, dates to remember, February 8th, February 9th. Those will be the Q&A sessions. We're going to be doing those via Zoom. Thanks to COVID, we get to do a lot of those more virtual. But that we'll record at least one of those so that you can, if you aren't able to attend, you'll be able to watch that. And additional sessions specific to pharmacy benefits will be on February 10th. We'll record that. And a transition of care located or on February 12th. And again, we'll record that and share with you. Open enrollment, so when can you sign up, will begin February 22nd through March 8th. And we'll have open enrollment meetings that will occur that week of February 22nd at each of the locations. Again, probably via Zoom unless something changes. I know you've probably got lots of questions. There'll be lots of changes as we go forward, but we look forward to meeting those changes as we provide this new benefit that will help change the way we use healthcare going forward and help improve the costs associated to it for you and I. Have a great day. Thanks.